Right after graduation, I went into acute care. That was my first job, and I was there for 4 years. And this was a locked unit, psychiatric unit, where we saw the range of people who came either from the community or emergency that have, diagnosis of anxiety, depression, bipolar disorder, schizophrenia, OCD, eating disorder. It's just was a catch-all unit. And it was incredibly jarring to be in that environment. Um, I remember being given a tour of the unit and just when I first started and I saw these people just kind of wandering the hallways with kind of glazed look on their faces, nurses, carrying cocktails of drugs and rushing. And then there was somebody banging on the door, on a locked door. And I was told this person was agitated, was put in a seclusion room. It was just a very chaotic environment. And I just remember thinking, this is really odd. And one of my roles as a psych nurse was to administer the drugs and that were prescribed by psychiatrists and monitor the effect of those drugs. And I was amazed right away how much drugs were used. It was really the main mode of treatment and the first line of treatment, and the rush for diagnoses. So, like you would see an emergency physician or a psychiatrist either in the community or in emergency or in acute care. And after 45 minutes, an hour of meeting this person, the person will have a diagnosis. And that diagnosis is going to follow them for the rest of their lives. And that's not based on a brain scan. It's not based on a genetic testing. It's not based on a blood work. It is from a book called the DSM of a list of criterias that is really subjective for the most part, either by the patient or the psychiatrist or whoever is making the diagnoses.
Mm-hmm.
And it's not to say that a diagnosis cannot be helpful. I think for clinicians, it can give them a framework to understand someone, but to confuse that diagnosis with a person's identity and who they are in their entirety is a huge disservice. And for many people, I noticed that a diagnosis initially might come as a relief, but then it becomes the chain that binds them and disempowers them. And for clinicians, once you label that person and you're looking at them from that lens, then everything is looked at in that context. You're not really getting to know this person, who they are. That's just one aspect of what's going on with them, life challenge or circumstances. So what I noticed with the drugs right away was patients would tell me it's not working, it's making them more agitated. For a portion of them, a portion of people just could not tolerate psychiatric drugs, period. And the ones that are considered psychiatrically stable on high doses of drugs, often multiple drugs, they always complained that they are having to live with serious effects of the medication, side effects. And I don't believe there's such a thing as side effects. There is whatever you're experiencing on that drug is the full effect of the drug. And so, they would have, especially the people who were on neuroleptic medications, but all of the psychiatric drugs, weight gain was a huge one, sexual dysfunction, fatigue, lack of motivation, lack of energy, brain fog. So this was like an all-pervasive sense of just being subdued. And a lot of people would say they can't access their emotions. And so very quickly, I realized that, first of all, the rush to diagnose, even though we take the person's history and to some extent in the context of what they've been through, what you're witnessing is understandable. Many of the people, I would say almost 100% of the people that I've worked with, had significant trauma history.
Mm.
And that's not to say that's the only factor. In fact, the issue is that there are multiple factors that impact a person's health, starting from utero to the grave, in terms of diet, the mother's stress while she was pregnant, nutrition, genetics. There's just a plethora of things that influence a person's mental health.
Mm.
And so those things are not really seriously taken into consideration, and the interventions given accordingly and truly explored before you come into a very high risk intervention, which is psychiatric drugs that have just the potential to wreck a person's life.
Well said. Yes. There's a few things I want to highlight just from what you just said. It's so validating for someone to hear the statement, given everything you've experienced, what you're going through right now makes perfect sense. It's totally understandable.
Mm.
It's not indicative that your brain is malfunctioning. And that there's this plethora of factors that can contribute to someone's emotional state or, distorted perceptions are not taken into consideration when developing an intervention. This is such an important point. We're missing the cause. We're not addressing the cause. And I think people are made to believe that by taking a drug that's been prescribed to them, they are addressing the cause, because they're made to believe that the cause is this chemical imbalance or some type of neurological abnormality that the drug supposedly is correcting, which we know, of course, that is not the case, but that's how people are led to believe. I also want to emphasize what you were talking about regarding diagnosis and maybe kind of add a little bit to that. I think this is a really interesting question. Like, what is the impact of a diagnosis? And like you said, it can come with relief. And then, though, it's kind of the chain that binds you and it follows you your whole life. And it's highly stigmatizing. And I would add to that it tends to instill into a person a very fixed mindset about their mental state. They believe that if they've been diagnosed with ADHD, well, that's just how their mind works. They're always going to be inattentive and impulsive. But that is not the case. And it's very important, I think, that people understand well that psychiatric diagnoses are descriptive, not explanatory. And I think, honestly, that part of the relief comes from misunderstanding these diagnoses as being explanatory. And just to kind of, elucidate what we mean here, that is to say that if you are having coughing fits every day and you go see a physician and then you're diagnosed with bronchitis, that's explanatory, right? We're saying the reason you're coughing is because you've been affected by this virus, and we call it bronchitis. That explains your coughing. That's how most medical diagnoses are made. But mental disorders are not diagnosed like that. They are diagnosed purely based on you presenting symptoms. And so, in other words, ADHD, for example, does not explain why you're inattentive and impulsive. It simply affirms that you are inattentive and impulsive. And the equivalent here with the coughing and bronchitis example would be like if you were coughing and you went to see a physician and they said, because you're coughing 35 times a day, I diagnose you as having coughing disorder. That's what mental disorders are like. So I don't want to kind of take away from any relief that someone may be experiencing having been diagnosed. I think the relief can be positive, but I also think it is based in misunderstanding the diagnosis as though it's explaining something. And I think the most problematic consequence of that is that when people are diagnosed and think it explains their condition, they then stop searching for the cause of their depression or their anxiety or their inattentiveness. there is a cause, which may be biological in nature, metabolic issues, hormonal issues, could be neurological abnormalities. Maybe a brain scan is called for, or it might be psychological in nature, like unresolved trauma, or it may be environmental in nature, like an abusive, stressful, impoverished community or household. And
Mhm.
so it's just such a terrible consequence that a person would stop looking for why they're depressed or anxious once they get a diagnosis. And again, that's because of this misunderstanding that these diagnoses are explanatory. And I understand why people misunderstand them in that way, given that every other medical diagnosis does tend to be explanatory.